Hello, I'm Dr. Robert LaLouche, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about a miscarriage and having a D&C. So I do have another video that talks about expected management, generally for earlier miscarriages, where you just follow hormone levels down. But if you're further along or having significant bleeding or cramping or other issues, then your provider might recommend a suction D&C. It is a relatively simple procedure. It's outpatient. You go in, you go to sleep, you come out, you feel like you're on your period. Probably the most difficult part of the whole thing is the emotional problems, the difficulties of dealing with the loss of your pregnancy. And I'm very sorry that you're going through this. I don't know your particular circumstances. As I said in the other video, there is in general a 1 in 12 risk of miscarriage. For all women, generally under 35, that risk starts to increase as you get older. At 44, the risk is 1 in 4, and it kind of goes up from there. There are other videos I have on what are the causes of miscarriage. That's not the purpose of this video. It's to discuss what is done with the D&C and what will your course be afterwards. So all surgeries have risks. Those risks are small. There is a risk of bleeding. You're going to bleed when you have a miscarriage, whether you have a D&C or not. It can be quite heavy at times. So you'll have a blood level to know where you're at, and there is a risk that you might need a blood transfusion. With the controlled environment and medications, that risk is low, but it's not zero. Blood is very well screened, so the risk of getting an infection from a transfusion is very low, but never zero, and we try to avoid it if we can, unless it becomes dangerous for you to proceed without it. So our cutoff in general is about a hemoglobin level of 7, or the normal hemoglobin level is about 13. That's just a frame of reference for you. Again, your specific circumstance may be different. So there is a risk of infection. That risk is low. Sometimes you can have a miscarriage and have something called a septic miscarriage or septic abortion. It's an unfortunate term. Doesn't mean anything to do with your decision or your choice, but it's medically speaking, they use the same term. So a miscarriage that has an infection can be a reason why you need to do a D&C. By doing the procedure itself, it reduces your risk of infection, but you might need some antibiotics to help reduce that chance. Afterwards, you may also have a risk of infection, so watch for fevers. It's in your list of concern, and report any fevers to your provider immediately. There is a risk of the anesthetic. Presumably you're young and healthy. If you're a smoker, you have a bad heart, you're overweight, you're older, you have higher risk, but still in general, this is a much safer surgery. There's no direct incisions, so your risks are smaller. For all surgeries, there's a risk of injury to adjacent organs. That means when you put sharp instruments near the human body, there's a chance someone will get cut or injured that wasn't meant to. It means doctors are human and errors occur. Things that can get injured are your vaginal walls, your uterus. There is a risk of perforation of the uterus. We're using instruments in your uterus, and when you have a pregnancy, your uterus is softer. Physicians are trained to deal with this. However, it can happen, and generally speaking, we just have to observe you. But potentially, if you get uncontrolled bleeding, you might need an open surgery, an emergency surgery to take care of the bleeding, and in rare instances, even a hysterectomy to stop the bleeding, and that would be kind of the end point. I have never had to do that in over 30 years of experience. It's more in my own personal experience. It's a really rare event. So those are some of the risks. The procedure doesn't take long. Afterwards, you generally feel like you're on your period. You will have some bleeding for a few days and some cramping. They'll give you usually some kind of non-steroidal anti-inflammatory like Advil, ibuprofen, and you may get some additional pain medications. And generally, you'll have some bleeding for a few days to up to a couple of weeks, but it should be decreasing amount and never to a dangerous amount or heavier than a period. If it is, then you need to let us know for follow-up. Generally, the follow-up period is 4 weeks. It might be 2, it might be 6, but for my patients, I generally see patients back at 4 weeks. Be attuned to the fact that your hormones may add to the additional sadness that goes along with the loss of a pregnancy. There are support systems available to you, and be sure and have some contact information if you think that that is of concern for you, or even if not, be sure and contact your physician or your provider. There is a support network out there to get you through this process. I hope you found this information of use. Please leave your comments. Thank you.